Good afternoon, everyone. I'm Dr. Lambert Loh, a consultant with the National Addictions Management Service at the Institute of Mental Health. It's my pleasure to speak with you today about a topic close to my heart, and that is on nicotine dependence and why it's so hard to quit smoking. Well, there are a few telltale signs and symptoms. Some people have what we call cravings to nicotine, in which their body experiences a desire or an urge to actually smoke when their blood nicotine levels fall below a certain threshold. Other people develop what we call withdrawal symptoms, in which they feel uneasy. They develop some symptoms like dizziness, lethargy, they feel easily tired, or they have poor concentration when they are experiencing withdrawal symptoms when they don't smoke. For some smokers, a large part of their life revolves around either smoking or obtaining cigarettes when they become addicted to nicotine. There are also other health consequences associated with smoking, especially when you're addicted to cigarettes, nicotine, and these include lung diseases like chronic obstructive lung disease, and even certain forms of cancers associated with smoking. And of course, the personal relationship problems, the problems arising, in their social circumstances, either at work or with their family members as a result of smoking, are some of the hallmark features that a person with nicotine dependence experiences. We have already talked about one important factor itself, which is nicotine, and the way it causes an addiction in terms of its addictive potential. But of course, there are many other reasons why someone is finding it so difficult to quit smoking. Some of these factors are psychological in nature, in which a person associates smoking with certain routines. For instance, when you first wake up in the morning, when they first take it with their breakfast. So it becomes a routine, and they feel that smoking has become embedded as a lifestyle. So it can become quite difficult to quit when something is part of your daily routine. And of course, some people also rely on smoking to cope with stress. Gradually over time, this then becomes a crutch for them to rely on, and they find it very difficult to disentangle themselves from difficult situations when you do not smoke. Then there is the social element of smoking. Smoking sometimes happens in a group setting in which smokers go out with their friends to smoke, even during meal times, for instance. So this social compact in itself can become quite difficult to break away from. So there are definitely physical, psychological, as well as social factors at play that make it difficult for a smoker to quit smoking. Well, the short answer to this is yes, it does matter. And this is because research has shown that even smoking one or a few cigarettes daily is associated with a higher risk of heart disease or stroke. And there is a higher death rate even among smokers who do not smoke daily. So it is imperative for anyone who is smoking to actually quit smoking completely rather than just reduce the amount of cigarettes that they smoke. First, let us explain what vaping is. Vaping is the act of inhaling a vapor produced by an e-cigarette, and e-cigarettes are gadgets that contain nicotine liquid as well as a heating element that aerosolizes the nicotine. Some e-cigarettes have been shown to contain a higher nicotine content than traditional cigarettes, and the vapors that they produce have been shown to contain cancer-causing chemicals. And vaping has also been associated with lung injury as well as lung inflammation. So vaping in itself is definitely harmful and not a safer alternative to smoking. Currently, the best treatment option that we have is a combination of behavioral support, usually in the form of counseling, together with pharmacological support, either in terms of nicotine replacement therapy or medications. What is important is to come up with an individualized treatment plan to help each and every smoker. And with this in mind, we do hope to emphasize that behavior change does take time, so it's important to be patient in this journey. As a final message, I do wish to encourage smokers to begin their journey on quitting smoking, and to emphasize that help is readily available, not just at the National Addictions Management Service, but also at pharmacies across Singapore, in our restructured hospitals, as well as in private pharmacies such as Guardians and Watsons.